Welcome to the Deep Dive. Today we're diving into how pharmaceuticals and fitness could work together
Oh, yeah.
with this strategy from Liba Kaplan.
Okay.
We've got her professional background and a detailed proposal outlining her approach.
Interesting.
Get ready,
Wow.
because she connects medication and lifestyle changes in a way that might surprise you.
Yeah, Liba's approach is really intriguing here.
Okay, so who is Liba Kaplan and why should we pay attention to her strategy?
So Liba's resume and this proposal kind of paint her as a real leader in pharmaceutical communications, especially when it comes to chronic illnesses.
Okay.
What's really captivating here is her focus on combining medication with personalized exercise
Interesting.
and how that can really be a game changer for patients.
So it's not just about taking a pill.
Not at all, no.
Oh.
Liba's proposal argues that obesity is multifactorial. It's a combination of things like genetics, diet, lifestyle, and even mental health.
Right.
Medications are definitely a part of the equation, but they work best alongside targeted exercise.
This is already making me rethink my approach to health.
Right.
Walk us through the highlights of her strategy.
Okay.
What makes it different?
It's all about customization. Liba dives into specific medications.
Okay.
Orlistat, liraglutide, semaglutide, and explains how each one interacts with different types of exercise.
Wow.
For example, someone taking a medication that curbs appetite might see incredible results from high-intensity interval training
Right.
or strength training.
Interesting.
On the other hand, someone struggling with emotional eating might find yoga or Pilates more beneficial.
Okay.
It's about finding the right exercise strategy to complement the medication.
It sounds like she's tailoring the approach to both the medication and the individual, which is not something you often hear.
Right.
It's not a one-size-fits-all approach to tackling obesity.
Precisely. And this is where her perspective becomes really, really valuable.
Okay.
It's about understanding an individual's needs and tailoring a plan that works for them.
And her CV seems to suggest she has the experience to back up these ideas.
Absolutely, yeah.
Right.
Her strategy seems to come from a really deep understanding of how these different medications work because she's seen it firsthand.
This has given me a lot to consider, but before we move on, I was curious about something I see in her proposal.
Okay.
Liba also mentions type 2 diabetes.
Yes.
Does her synergy approach apply there too?
It does, and this is where things get even more interesting.
Yeah.
If you recall, we talked about obesity being multifactorial.
Right.
Type 2 diabetes is very similar.
Yeah.
Liba points out that exercise isn't just a nice-to-have when managing it. It's essential.
So with type 2 diabetes, exercise becomes another crucial piece of the puzzle, just like with obesity.
Exactly. And she even breaks down how different diabetes medications like metformin and GLP-1 agonists work best when combined with physical activity.
You mentioned GLP-1 agonists.
Yeah.
For those of us who aren't medical professionals, can you unpack what those are?
Of course, GLP-1 agonists are a class of medications that essentially mimic a hormone in your gut that tells your brain you're full.
Interesting.
This can be incredibly helpful for people who struggle with constant cravings or overeating.
It's like hitting the brakes on your appetite.
Yes, exactly.
Okay.
And Liba argues that these medications, while effective on their own, are even more powerful when paired with the right exercise.
Let's zoom in on those obesity medications Liba highlights.
Sure.
We hear names like Orlistat, liraglutide, and semaglutide a lot these days.
Yeah.
But how do they actually work?
Let's break them down.
Okay.
First, you have Orlistat, which you might know as Xenical or Ali.
Okay.
It basically prevents your body from absorbing the fat you eat.
So less of the fat you consume actually stays in your body.
Precisely.
Wow.
Then you have liraglutide and semaglutide, which are those GLP-1 agonists we were talking about.
Right.
They work by mimicking that fullness hormone, helping to regulate appetite.
It's all fascinating stuff.
Yeah.
I'm starting to see how different medications, by targeting different aspects of obesity or diabetes, might then benefit from different forms of exercise.
Right.
But you give us some concrete examples.
Absolutely. Let's take someone taking Orlistat, for instance.
Okay.
Since this medication is already preventing fat absorption, incorporating high-intensity interval training, or HIIT,
Right.
could be incredibly effective. HIIT is known for its ability to boost metabolism and burn calories even after you've finished exercising.
Yeah.
So you're getting a double whammy in terms of fat management.
That makes a lot of sense.
Right.
What about someone taking a GLP-1 agonist?
In that case, since the medication is already helping to manage appetite and cravings,
Right.
incorporating yoga or Pilates could be beneficial.
Interesting.
These practices can help reduce stress, which is often a trend for emotional eating.
Yeah.
By managing stress through exercise, you're further supporting the medication's efforts to control appetite.
It sounds like Liba is advocating for a much more personalized and holistic approach to managing these conditions.
Exactly. And it's not just about the physical benefits of exercise, although those are significant.
Yeah.
It's also about the mental and emotional benefits.
Right.
Exercise can improve mood, boost confidence, and contribute to a greater sense of well-being.
It's interesting you mentioned earlier that exercise is essential for managing type 2 diabetes.
Yeah.
Can you elaborate on why that is?
Of course. Type 2 diabetes occurs when your body either doesn't produce enough insulin or doesn't respond to it properly.
Okay.
Insulin is a hormone that regulates blood sugar levels. When there's an issue with insulin glucose, which is sugar from the food we eat, builds up in the bloodstream.
And that can lead to a whole host of health problems.
Right now, here's where exercise comes in.
Okay.
Physical activity actually improves your body's sensitivity to insulin.
Interesting.
This means your cells become more efficient at using insulin to absorb glucose from the bloodstream,
Right.
which helps lower your blood sugar levels.
So even if you're not necessarily trying to lose weight, exercise can still be a powerful tool in managing type 2 diabetes.
Absolutely. It's one of the best things you can do for managing this condition.
Wow.
And as with obesity, combining exercise with the right medication, such as metformin, can further enhance its effectiveness.
What I'm getting from Liba's approach is that it's not just about treating symptoms,
Right.
but about addressing the underlying mechanisms of these chronic conditions.
Yeah.
It's about understanding how lifestyle factors can be just as important as medication.
You hit the nail on the head, and that's what makes Liba's strategy so significant.
Okay.
It challenges the traditional model of relying solely on medication and instead emphasizes a more holistic, patient-centered approach.
It's about empowering individuals to take control of their health and well-being.
Precisely, and understanding that even small changes can make a big difference.
This has been incredibly eye-opening, but I'm left wondering, what are the broader implications of Liba's approach? If her strategy of combining medication with personalized exercise were to become more widely adopted, what kind of impact could that have on healthcare? What are the broader implications of Liba's approach? If her strategy of combining medication with personalized exercise were to become more widely adopted, what kind of impact could that have on healthcare?
That's a really thought-provoking question. If we imagine a healthcare system that embraces this approach, we could see some pretty dramatic shifts. Imagine a future where treatment plans aren't just about prescriptions, but also include tailored exercise recommendations based on your individual needs and the medications you're taking.
It suggests a move towards truly personalized medicine.
Exactly, and that personalization could lead to a cascade of positive outcomes. We could see improved effectiveness of treatments for conditions like obesity and type 2 diabetes. Imagine people not just managing their conditions, but actually seeing significant improvements in their health because their treatment plan is so targeted.
It's exciting to think about. And it's not just about individual health outcomes, is it? There could be broader societal benefits, too.
You're absolutely right. When we look at the bigger picture, this approach has the potential to impact healthcare costs as well. If we can better manage these chronic conditions through personalized strategies that combine medication and lifestyle changes, we could see a reduction in the long-term healthcare spending associated with these conditions.
It's a win-win situation. Improved health outcomes for individuals and potentially reduced healthcare costs overall. It makes you wonder why this approach isn't already the norm.
It's certainly a shift in thinking, but Liba's proposal highlights just how powerful that shift could be.
Liba's proposal really challenges us to rethink our approach to health. It's not just about relying on medication alone, but about understanding how lifestyle factors like exercise can play a crucial role.
It's about empowering individuals to take an active role in managing their health. It's about recognizing that what works best for one person might not be the right fit for another. It's about personalized solutions that address the unique needs of each individual.
It's been an incredibly insightful deep dive into Liba Kaplan's fascinating approach.
It certainly has.
And to our listeners, we hope this has given you much to consider. The intersection of pharmaceuticals and lifestyle changes is a complex and rapidly evolving area, and we encourage you to stay curious, stay informed, and keep asking those thought-provoking questions. Until next time.